We've been reporting there's a statewide alert because of the smoke from the Canadian wildfires. Joining us now to answer questions is Dr. Daniel Kritzkis, Chief of Infectious Diseases at the Brigham. Dr. Kritzkis, thanks for joining us.
Happy to be here. Good to see you, Erica and Ben.
All right, Dr. Kritzkis, we know that people with heart or lung disease or asthma should be careful, but what kinds of effects could this have on otherwise healthy people? I know Erica and I were just both discussing this. We can both feel this, at least in our throats right now.
Yeah, I think that's really what you're going to feel. People might have some irritation in their eyes. They'll feel a little bit of scratchiness in their throats. I don't think that most people who don't have an underlying respiratory condition have a lot to be concerned about.
Well, that's good to hear. But for people who are feeling some respiratory distress, how can they tell if it's, allergies, if it is the bad air quality, maybe something else? And when should people decide to be actually seen by a doctor?
Yeah, it may be hard to distinguish allergy symptoms from the irritation that you might feel from the current pollution in the air. But what should really concern people is certainly if you have any fever and if you develop any shortness of breath, or if you have severe wheezing that makes it hard to breathe. Those would all be reasons to seek medical attention.
And so what should folks do to protect themselves and their families right now?
I think if you do have an underlying respiratory condition, then staying indoors where there's air conditioning that might filter out the particulate matter in the air, or wearing a mask actually to help prevent you from inhaling the particulates would be very helpful.
Okay, Dr. Kritzkis, thanks as always for being with us. Good to see you.
Thank you.
You're very welcome.